At the helm of the effort are 3 specialists who work closely with local specialists and support staff. Their work has been to conduct advanced heart procedures never before done in Belize. After 52 such cases, the team left this morning, but not before speaking with the media.
Cardiac catheterization is one of the ways that we'll identify some of these problems, such as severe cardiovascular blockages, coronary artery disease, significant valvular heart disease, shunts, holes in the heart. And by doing catheterization, we're able to identify these problems before they get to the point that they cause consequences to the patient, so at a point where they are treatable. What is done with a cardiac catheterization is a tube is placed into the artery through the leg. We're doing through the femoral approach. The catheter is advanced to the aorta where the arteries that feed the heart come off. We inject X-ray dye into each one of the arteries that feed the heart to visualize any potential blockages or any potential shunts, holes that may be there. We also measure the blood pressures in each of the heart chambers to determine if they're elevated or abnormal, and then are able to visualize the pumping function of the heart and measure the pressures across the different valves in the heart to determine if there's any significant stenosis or regurgitation, leaky valves. Not every problem can be corrected, and that's unfortunate. But it does identify a number of cases which are treatable, or it helps guide our therapy. In other words, is this something that needs to be fixed with an operation? Is this something that needs to be fixed with a balloon procedure or a stent? Is this something that can be treated medically? Are we on the optimal medical treatment? By measuring our pressures, it helps guide our therapy in determining what types of medications people should be on.
While the visiting team identifies those medications and treatment that people should be on, they departed the country. Until their return, the KHMH is still in its infancy stage in getting its own cardiologists trained to fill the growing demands for the procedure, as Belizean cardiologist Dr. Curtis Samuels and KHMH Chief Medical Officer Dr. Adrian Coy announced.
Here at the Khmh Memorial Hospital, we don't have anybody has the training or the skills in cardiac catheterization from a coronary perspective. But the plan is to actually involve training. So when the Heinemann Foundation initiated this project, the intention was actually to have Dr. Kowalchuk and the other interventional cardiologists and their team come in for an appropriate period of time during which training of a local Belizean would take place. Local team. Right? So in actual fact, the idea is to have a local team trained in the event that something acute would occur.
Where team building occurs, it involves nurses, cardiac cath specialists, and the cardiologists all achieving the skills. And we have already sent one person in the as a cardiac cath specialist who has done training in the US and in Guatemala and has now returned. And that is part of the first steps. Other of our trainees, Marilyn Aspinall, for example, has gone up for exposure, and that development will continue. And our cardiologists, we expect as well, Dr. Samuels, to go and train to get the necessary skills.
Locally, coronary angiography costs the patient $1,500 compared to $2,000 if done in neighboring countries, or $15,000 US if conducted in the United States. Here at home, the KHMH also offers a payment plan to patients who cannot afford to foot the bill all at once. Marian Ali for Love News.